There's some new FDA recommendations on plastic surgery, particularly when it comes to one of the most popular forms of that, which is breast augmentation. Dr. Jeffrey Antimarino is a board-certified plastic surgeon, and he joins us to talk about this. Thank you for being here again, sir.
How are you? Great being here. I always love being on
All right.
the show.
What do you think of these FDA recommendations?
You know, right now they are recommendations, and reading through them, what they're trying to get out there is just more transparency. And they want physicians to really be talking to patients about that these implants are not permanent devices. They have a lifespan, that there are issues with them, forming a capsular contracture, things like there might be some migration or malposition. But these are things that the physician should be talking to the patient about anyway. And so I'm for it. I think that the more transparency you have with the patient, the better they're going to make the decision of what's best for them. And it was funny because I was going through some of the proponents that they want to have on sort of the black box labeling, and they want a checklist. But on our informed consent in my office, every patient that wants to talk about implants, whether it's a breast reconstruction or a breast augmentation, gets this informed consent, and every one of those is on there. And we've used that for years. So I think it forces the surgeons to be more upfront with patients, and I think that's a good thing. A patient should know that there are problems with the implant. They're extremely small, but they should still know about it. And now, of course, I talked to them about the association with the large cell lymphoma, or even the other issues.
Yet and still, it seems as though you're trying to minimize this. There has been a suit that has come against a company that you are on the advisory board of that says that you have not, or this agency that you're on the advisory board has not informed patients of these things that we're talking about right now.
Right. No, and I'm not minimizing at all. And the last time I was on the show a couple months ago, and we were talking about when it was really coming out about the large cell lymphoma, and it's not the implant itself, it was the chemical used to texturize it. And you asked me about it, is this something that needs to be put out there? And I said it is, but it has to be put out there in a responsible way so it doesn't cause more panic than it is. There's been 574 cases since 2011. So yes, it's reportable and women should know about it. But I don't think that you want to make a widespread panic, because the incidence at this point is low, and we do know what to do about it. So
with the incidence being low, should your organization, who has had these implants, offer to replace them because they're with women who have had problems with them?
They have, and what they've done is they've backed the fact that if any woman wants to have the implants removed, they'll replace the implants for free.
But Allergan won't pay for them.
They'll pay for the implants, absolutely. So if a woman comes in...
And the procedure too?
They won't pay for the procedure.
Okay.
And the reason for that, and talking with Allergan, the reason for that is because the FDA has said they're recommending only women that are having symptoms, and then Allergan would certainly be behind helping them. But for ladies that are not having symptoms, which is 98% are not having symptoms, the company's saying, it's not mandated by the FDA. We want people to be aware. We're putting it out there. They are putting out information in different advertisement forms for women to know what the symptoms are. Localized swelling on one breast, pain, all of a sudden you're having pain in one breast, changes in the breast, changes in firmness or softness of the breast. These are things, and it's what we've been talking about, just as plastic surgeons for any implant. You should, if there are changes going on in your breast, you should see your surgeon or a board-certified plastic surgeon to be evaluated. In my practice, I haven't used textured implants since I was really just out in practice. I haven't used them for over 16 years. I never liked them. I use the smooth round, so it's really hasn't been an issue for me in my practice, which I'm glad I didn't like them.
Whether it's for reconstructive purposes or cosmetic,
right.
What do you tell women about the lifespan of these? You alluded to that before.
Right.
The lifespan of these implants.
So every woman that comes in in my office, that is one of the discussion points. So the silicone implants are probably somewhere in a 25 to 30 year range, and I tell those ladies what to look for when those implants are towards the end of their lifespan. Saline implants on average are about 15 years. There are ladies that will go longer than that or shorter than that. A saline implant will rupture, and that's how you'll know for sure, because one breast slowly deflates. And again, I make sure they understand if you have saline implants and that happens, you won't feel it happening. It's not a risk. It's not a health problem. It's just now you have to make sure that you get in to have them replaced.
Dr. Jeffrey Antimarino is our guest. He's a board-certified plastic surgeon. When we continue our interview with him, we're going to ask him about a number of things, including do-it-yourself improvement, cosmetic surgery, and what we need to do with obese children. Should they have cosmetic surgery too to reduce their weight? There are a lot of questions that we have for him, and we'll ask them as our program continues. Dr. Jeffrey Antimarino is our guest, and we turn to him now about do-it-yourself cosmetic surgery.
Yeah.
I read an article about this in preparation for the show. People are injecting botox into their own skin. This is a little bit beyond the pale, isn't it?
Yeah, listen, people have been injecting either themselves or other people off-label brands for years. It is not safe. There's nothing safe about it.
They don't know where the stuff comes from, do they?
Absolutely. There was an outbreak not more than a few years ago where people were using off-label Botox, and there has actually been some deaths from it. So, you know, if you're even thinking about that, I mean, that's just ludicrous.
This sounds like something you should leave to a professional. What about dermabrasion techniques and these other kinds of devices that are being sold on the internet?
Those are $1-million businesses that are out there, and you know, some of the stuff is really not too bad. You know, there's exfoliators out there. There's really gentle peels that can help with texture, but they're very benign and they're very superficial. So, you know, if you're doing that at home just for skincare, that's okay. But there's dermabrasion, there is microneedling that we do in the office. But you have to remember, though, that the stuff that you're buying over the counter is not anywhere near the medical grade that you would get at an office.
You also have to know something about facial muscle structure and where to inject this, right?
The Botox, for sure. I mean, you can really have issues. Even trained injectors have to know exactly where the muscle bellies are, what they're doing, because you can get lots of problems with it. So, I mean, bruising and lid lag and brow ptosis, those are small things compared to what can happen.
Lip lag?
Lid lag, where the
lid lag.
eyelid.
I thought you said lip lag.
But people put it around their mouth too. I mean, if you get it deep enough and you get into that muscle around the mouth, now you'll be drooling for a while because that muscle won't work.
What about this lip plumping thing?
The suction.
Yeah, the suction.
That's just, you know, they've been doing that for years.
That can misalign your teeth, can't it?
Yeah, well, it doesn't make any sense. I mean, you can get bruising in the lips. It's for a very short period of time. You know, people are doing it, and I think they're taking pictures, but it's not going to last more than, you know, minutes to an hour maybe. But why would you do that? Why would you?
We don't have much time left, so forgive me for rushing. Obese children, are they good candidates for weight loss surgery?
You know what, I think, honestly, I think that there are other ways that we're getting away from, and this is just my opinion, I have nothing to back it up, but I think that the problem is with all of us, it's our lifestyle and our eating habits, and I think that as parents passing it on to our children, and I think that, I've read the articles that the pediatric groups are kind of getting behind gastric bypass and gastric sleeves for these kids. I don't know, personally, I just don't think that's the way to go. If you have a child that is in you know, having issues with their heart, diabetes, things like that, it might be a last-ditch thing that you might want to do. But I think training
going through the drive-through at fast food burger
I think that's the thing. We have to set the tone as parents and as a medical community that lifestyle, food choices, being good to your body, exercise, getting out, leave the video games behind, go out and ride bikes, go do that stuff that we had as kids. I think we need to get back to that and not resort to surgery for every little thing that ails us.
All right, let's talk about about plastic surgery tourism.
Yeah.
Is it a good idea to go overseas to get something done cheaper than you can get done here in the United States?
My feeling on that is about as smart as injecting Botox on yourself at home. The thing that people don't realize, they're looking at just the cost. So it's cheaper to go to the Dominican or to Thailand. The problem you're not thinking about is, what about the follow-up? How are you going to go back and see these other doctors? If you're having a complication, what about stitches and drains and swelling? You know, I see my patients regularly, every week for a while, then every couple of months, and you know, this goes on for 6 months to a year. Routine visits because of those questions. If you have somebody in Thailand or the Dominican, are you going to fly back every time to do that? And I got to tell you that as a surgeon here in the country, I'm not going to take that on. I don't know what was going on down there. The other thing is, you don't know what that surgeon is down there. If he is a surgeon or she's a surgeon, you have no idea, because there's no accreditation, there's no FDA, there's no board certification. There's nothing. You could be going down there, and this guy could be a mechanic for all you know.
And it's hard to sue somebody overseas, too.
No lawsuits across the country. I mean, across the waters. So I would tell you, if you're thinking about that, you got to look at the whole picture. Where's the, you know, where are you spending your money? When you're here spending that kind of money, you know you're getting somebody. Hopefully, you've done homework and they're board certified. But you know you have follow-up, you know you have questions, you know that you have an office that is clean and sterile. The environment that you're having the surgery has been accredited and sterile, so that your rate of infection is less.
Sounds
I had this problem before.
Sounds like the good thing to do, the wise thing to do if you're considering some sort of cosmetic surgery.
Right.
Dr. Antimarino, thank you as always for appearing on our program. We appreciate your expertise.
I appreciate being back.
All right. I'm Chris Moore. We're going to turn our attention to the holiday Thanksgiving Day Parade at Macy's and the musical group that's going to headline it. That's next on this edition of Pittsburgh Now.